We've seen about the changes seen in the uterus, cervix, vagina and the perineum in our last video. And now let's continue by seeing the systemic changes seen during the puerperium. In the systemic changes, first we'll see about the fluid balance and hormonal changes. Just after delivery, the female loses some 3 to 4 kgs of weight due to the excretion of fluids and electrolytes by increased urination. This is most commonly seen in the first 2 weeks just after delivery. Next, there is also change in the hormonal levels like HCG, estrogen, progesterone. All these decrease to normal levels, that is the pre-pregnant levels. Next, coming to the changes seen in the CVS. In the CVS, the hematocrit increases by about 5%. There will be leukocytosis, that is increase in WBC count, and thrombocytosis, that is increase in platelets. Then the blood volume gets decreased by 20%. The cardiac output peaks after delivery to about 80% of the pre-labor value, and it remains so for 2 days postpartum. Next, coming to the urinary tract. So after delivery, there will be edema and hyperemia of the bladder mucosa. Also, urinary retention is more common after episiotomy, instrumental delivery, and epidural analgesia. Also, we should rule out the presence of any urinary tract infections. An important point to note here is that if the female is not able to void within 4 hours of delivery, the vulval, vaginal or genital tract hematoma should be ruled out. Those can be the cause for not processing urination within 4 hours of delivery. Also, the dilated aerators which were tortuous, they return to normal within 4 to 6 weeks. Also, there is increased micturition on the day 2 or day 3 of the Peurperium. Next will be the abdominal wall and peritoneum. The stria gravidarum, which appeared during the antenatal period, persists then the abdominal wall remains flabby for few days, and then it tries to regain its original, but a certain amount of laxity will be permanently sustained unless we give proper exercise for the abdominal muscles. So we should do proper exercise and massage to regain the tone of muscles. This is about the systemic changes. Now let's see about the lactation. First comes the physiology of lactation. So the hormones which are responsible for lactation and those that are involved in lactation include progesterone, estrogen, placental lactogen, etc. Also, the prolactin and the cortisol play a role here. So, with the derivative of placenta, there is sudden decrease in the levels of estrogen and progesterone which stimulate lactation. So, the progesterone and estrogen levels suddenly decrease, leading to lactation, which serves as a precipitant factor. Next, prolactin is a very important hormone which is needed for lactation, production of milk. Then there is lactation, which occurs through a letting down of the milk. Also, initially for the first 1 to 2 days, a thin liquid is secreted from the breast which forms the colostrum. The breast becomes bigger and the veins become more prominent. Next, something about the colostrum. Colostrum is a secretion from the breast within 24 hours of delivery, which is of deep yellow color, alkaline in nature, and it is rich in fat globules, and there will be presence of colostrum corpuscles, which are round or stellate cells which contain lactalbumin and lactoglobulin and more minerals. Next is immunoglobulins. IgA, immunoglobulin A, is present in breast milk, which gives protection for the newborn against the enteric pathogens. So the protein in milk consists of one-third casein and two-third lactalbumin. So now coming to the composition in an average of human milk. The average composition includes protein constitute for 1 to 2%, sugar for 6.5 to 8%, the fat constitute for about 3 to 5%, and it also has salts 0.1 to 0.2%. The rest is made up by water. So the breast milk is very much rich in water. Next to that is sugar, followed by fat, protein and salts. So the human milk has a slight laxative action, and thereby it helps to clear the meconium. And one thing to be noted is vitamin K is absent in human milk. All other vitamins are present, whereas vitamin K is absent in human milk. Now let's see the factors affecting the milk secretion. The milk flow rate is about 850 ml per day, which accounts for about 600 calories lost every day by the mother. So the milk secretion is affected by many factors like diet, hormones, mental condition and drugs. All these can interfere with lactation. So the drugs which are excreted through breast milk include certain antibiotics, sulfonamides, salicylates, alkaloids, etc. Coming to the advantages of breastfeeding, it provides the right balance of nutrients, immunological factors, and antibacterial properties. So next is lactation inhibition. So avoiding the stimulation of breast can inhibit lactation. So the avoid stimulation and keep the breast supported to inhibit lactation. So initially the breast may become enlarged and painful. Which can be relieved by applying ice packs or taking some analgesics for 12 to 24 hours. So this is all about the systemic changes and about the lactation. We will see the rest in our next part of the video, the link for which will be provided in the description. Also, the link for the previous part of the video has also been posted in the description box. Please check it out. That's it for this video. Thank you.